Welcome to our lesson on English for healthcare workers. Working in healthcare requires not only technical knowledge but also clear, empathetic communication skills. As a healthcare professional in an English-speaking environment, it's essential to communicate effectively with patients, families, and colleagues. In this comprehensive lesson, we'll explore important medical terminology, discuss effective patient communication strategies, and practice common scenarios you'll encounter in healthcare settings. We'll cover everything from taking patient histories to explaining procedures and discussing treatment plans. By the end of this session, you'll have expanded your healthcare vocabulary and gained confidence in your ability to communicate clearly and compassionately in medical contexts. So let's begin building these crucial language skills for your healthcare career. Let's start with fundamental medical terminology that's essential for healthcare professionals. Having command of these terms will help you communicate precisely with colleagues and explain concepts clearly to patients. Let's start with the cardiovascular system, which refers to the heart and blood vessels responsible for circulating blood throughout the body. For example, the patient's cardiovascular system showed signs of strain after the stress test. In this example, signs of strain means the heart and blood vessels were working too hard and showing potential warning signs of heart problems. Now let's look at the respiratory system, which consists of organs involved in breathing, including the lungs, trachea, and bronchi. For example, the respiratory therapist assessed her breathing pattern and oxygen saturation. Here, oxygen saturation refers to the amount of oxygen in the patient's blood, which indicates how well the lungs are functioning. Another important system to understand is the gastrointestinal tract, which refers to the stomach and intestines responsible for digestion. For example, he's experiencing pain throughout his gastrointestinal tract, particularly in the lower abdomen. In this context, pain throughout the gastrointestinal tract suggests the patient has discomfort along the entire digestive pathway, not just in one localized area. We should also talk about the musculoskeletal system, which includes the bones, muscles, ligaments, tendons, and connective tissues. For example, the physical therapist designed exercises to strengthen her musculoskeletal system following surgery. Here, strengthen her musculoskeletal system means rebuilding muscle strength and improving joint function after a period of reduced mobility. Moving on to the neurological system, this encompasses the brain, spinal cord, and nerves. For example, the neurological examination revealed normal reflexes and motor function. In this example, normal reflexes and motor function indicates that the patient's nerves are properly transmitting signals for automatic responses and voluntary movements. Finally, let's discuss the integumentary system, which refers to the skin, hair, nails, and associated glands. For example, the dermatologist specializes in treating disorders of the integumentary system. Here, disorders of the integumentary system refers to any condition affecting the skin, such as rashes, infections, or abnormal growths. Let's review vocabulary for common medical conditions you'll encounter. One of the most common conditions you'll encounter is hypertension, which refers to persistently elevated blood pressure above normal limits. For example, the doctor prescribed medication to control his hypertension and recommended lifestyle changes. In this context, control his hypertension means bringing the patient's abnormally high blood pressure down to safer levels through medication. Another prevalent condition you'll see is diabetes mellitus, a chronic condition affecting how the body processes blood glucose. For example, she manages her diabetes mellitus through insulin therapy, diet, and regular exercise. Here, manages her diabetes refers to keeping blood sugar levels within a target range through multiple approaches rather than curing the condition. You'll need to be familiar with myocardial infarction, which is the medical term for a heart attack, occurring when blood flow to part of the heart is blocked. For example, the patient was admitted with symptoms consistent with an acute myocardial infarction. In this example, acute myocardial infarction indicates a sudden, severe heart attack that has just happened, requiring immediate medical intervention. Similarly important is understanding cerebrovascular accident, the medical term for a stroke, when blood flow to part of the brain is interrupted. For example, the rehabilitation team is working with patients recovering from cerebrovascular accidents. Here, recovering from cerebrovascular accidents refers to the long process of regaining functions that were lost due to brain damage from the stroke. Many respiratory patients will have chronic obstructive pulmonary disease, which refers to progressive lung diseases that cause breathing difficulties. For example, patients with chronic obstructive pulmonary disease often require oxygen therapy and pulmonary rehabilitation. In this context, oxygen therapy and pulmonary rehabilitation indicates supplemental oxygen to improve breathing and specialized exercises to strengthen respiratory muscles. In older patients, you'll frequently see osteoarthritis, a degenerative joint disease causing pain and stiffness. For example, the orthopedic specialist recommended joint replacement surgery for her advanced osteoarthritis. Here, advanced osteoarthritis means the joint cartilage has severely deteriorated to the point where conservative treatments are no longer effective. Let's discuss common diagnostic procedures and tests. A fundamental test you'll often order is a complete blood count, CBC, which is a blood test that evaluates overall health and detects various disorders. For example, the complete blood count showed elevated white blood cells, indicating possible infection. In this example, elevated white blood cells means there are more immune cells than normal in the bloodstream, which is typically the body's response to fighting an infection. For more detailed internal imaging, you might request a computed tomography (CT) scan, which uses X-rays to create detailed images of internal structures. For example, the radiologist reviewed the CT scan to assess the extent of the abdominal mass. Here, assess the extent means determining the size, location, and characteristics of the abnormal growth to guide treatment decisions. When you need even more detailed soft tissue imaging, a magnetic resonance imaging (MRI) uses magnetic fields and radio waves to create detailed images of organs and tissues. For example, the orthopedic surgeon ordered an MRI to evaluate the knee ligament injury. In this context, evaluate the knee ligament injury means examining the detailed images to determine if the ligament is stretched, partially torn, or completely torn. To evaluate heart function, you'll frequently use an electrocardiogram, ECG or EKG, which records the heart's electrical activity to detect abnormalities. For example, the ECG showed irregular rhythms, so we're referring him to a cardiologist for further evaluation. Here, irregular rhythms indicates that the heart is not beating in a normal pattern, which could signify various cardiac conditions requiring specialist assessment. For direct visualization of internal organs, an endoscopy involves examining internal organs using a flexible tube with a light and camera. For example, the gastroenterologist performed an endoscopy to investigate the source of his recurring digestive symptoms. In this example, investigate the source means directly observing the inside of the digestive tract to identify ulcers, inflammation, or other abnormalities causing the symptoms. When tissue analysis is needed, you'll perform a biopsy, which involves removing a small tissue sample for laboratory examination. For example, after finding the suspicious mass, we scheduled a biopsy to determine if it's malignant or benign. Here, determine if it's malignant or benign means analyzing the cells under a microscope to check whether the growth is cancerous or non-cancerous. One of the most important skills for healthcare workers is gathering accurate patient information. Let's explore the language used during patient assessments and history taking. Let's review phrases to establish rapport and begin the assessment. The first step in establishing rapport is introducing yourself and your role, which helps establish professional rapport. For example, "Good morning, I'm Sarah Jones, the registered nurse who will be taking care of you today." In this context, specifying the registered nurse who will be taking care of you clearly communicates your professional role and responsibility in the patient's care. Next, you should focus on explaining the purpose of the assessment, which helps patients understand what to expect. For example, I'm going to ask you some questions about your medical history to help us provide the best care for your current condition. Here, to help us provide the best care explains the benefit to the patient, making them more likely to share detailed information. Always remember the importance of obtaining consent, which respects patient autonomy and rights. For example, is it all right if I ask you some questions about your health history and current symptoms? In this example, asking, "Is it all right?" acknowledges the patient's right to privacy and their control over their personal information. It's also crucial to consider ensuring privacy, which creates a safe environment for disclosure. For example, we can close the door for privacy during our discussion if you'd prefer. Here, offering to close the door for privacy demonstrates respect for confidentiality and sensitivity to the personal nature of health information. Many patients worry about confidentiality, so addressing concerns about confidentiality reassures patients about information sharing. For example, everything you tell me is confidential and will only be shared with the healthcare team involved in your care. In this context, only be shared with the healthcare team involved in your care clearly defines the boundaries of information sharing. Before diving into detailed questions, setting expectations for the interview helps manage time and focus. For example, this initial assessment will take about 20 minutes and will cover your symptoms, medical history, and current medications. Here, specifying about 20 minutes helps the patient mentally prepare for the length of the interaction and understand what topics will be covered. Let's explore phrases for investigating the patient's main concerns. When a patient arrives, start by eliciting the chief complaint, which focuses on the primary reason for seeking care. For example, "What brought you to the hospital today?" Or "Can you tell me what's been bothering you?" These open-ended questions invite patients to describe their main health concern in their own words, rather than leading them toward a specific answer. Once you understand their main concern, begin exploring symptom characteristics, which helps gather detailed information. For example, can you describe the pain? Is it sharp, dull, or throbbing? On a scale of 1 to 10, how would you rate it? Here, asking for specific descriptors helps translate the patient's subjective experience into clinical terminology that can guide diagnosis. Then it's important to focus on investigating onset and duration, which establishes the timeline of symptoms. For example, when did you first notice these symptoms? Have they been constant, or do they come and go? In this context, understanding whether symptoms are constant or come and go helps differentiate between chronic, intermittent, or acute conditions. To understand patterns better, ask about identifying aggravating and alleviating factors, which helps understand symptom patterns. For example, does anything make the symptoms worse? Have you found anything that helps relieve them? These questions reveal potential triggers or treatments by identifying what worsens or improves the symptoms. Don't forget to ask about reviewing associated symptoms, which helps build a comprehensive picture. For example, have you experienced any fever, nausea, or dizziness along with the chest pain? Here, asking about associated symptoms can reveal important diagnostic clues that the patient might not have thought to mention. Finally, inquire about asking about self-treatment attempts, which reveals patient actions. For example, have you taken any medications or tried any remedies for this problem before coming in today? This question provides information about what treatments have already been attempted and how the patient manages their health. Let's review phrases for gathering comprehensive background information. After addressing immediate concerns, you'll need to ask about inquiring about past medical conditions, which establishes health patterns. For example, do you have any chronic health conditions such as diabetes, high blood pressure, or heart disease? In this question, listing examples like diabetes, high blood pressure, or heart disease helps patients understand what types of conditions you're asking about, as they might not consider all relevant conditions medical. It's also essential to continue by reviewing surgical history, which identifies previous interventions. For example, have you had any surgeries or medical procedures in the past? When were they performed? Here, asking when were they performed provides important timeline information that can affect current care decisions. A crucial part of the assessment involves asking about current medications, which prevents interactions and identifies management patterns. For example, what medications are you currently taking, including prescription, over-the-counter, and supplements? In this question, specifically mentioning over-the-counter and supplements reminds patients to include non-prescription substances they might not consider medications. For patient safety, always focus on checking for allergies, which prevents adverse reactions. For example, do you have any allergies to medications, foods, or other substances? What happens when you're exposed to them? Here, asking what happens when you're exposed distinguishes between true allergies and side effects or intolerances, which require different precautions. To understand genetic risk factors, spend time gathering family health history, which identifies genetic risks. For example, is there a history of heart disease, cancer, or diabetes in your immediate family? In this context, immediate family focuses on first-degree relatives whose genetic similarities pose the most relevant risk factors. Finally, round out your assessment by exploring social determinants of health, which provides context for care planning. For example, can you tell me about your living situation? Do you live alone or with others? Do you have support for daily activities if needed? These questions go beyond medical factors to understand the social context that affects the patient's ability to manage their health. Effective patient communication involves more than medical knowledge. It requires empathy, clarity, and cultural awareness. Let's explore strategies for clear patient communication. Let's review approaches for clearly explaining medical interventions. When explaining medical concepts to patients, focus on using plain language, which ensures patient understanding. For example, instead of saying, "We'll perform a venipuncture," say, "I need to take a blood sample from your arm using a needle." This translation from medical jargon, venipuncture, to everyday language, "take a blood sample from your arm," makes the information accessible to patients without medical backgrounds. For complex treatments, try breaking down complex information, which makes it more digestible. For example, the treatment has 3 main steps. First, we'll administer medication to reduce inflammation. Second, we'll start physical therapy to restore movement. Third, we'll teach you exercises to prevent recurrence. Here, presenting the treatment as numbered steps creates a clear mental framework for the patient to understand the process. To help patients feel prepared, practice describing sensations patients might experience, which helps prepare them. For example, during the procedure, you might feel pressure in your lower back, but it shouldn't be painful. If you do feel pain, please let me know immediately. This explanation distinguishes between expected sensations, pressure, and unexpected ones, pain, empowering the patient to report problems appropriately. Patients are more likely to follow treatments when you're explaining the purpose of interventions, which increases cooperation. For example, this antibiotic will help fight the infection causing your pneumonia. It's important to take all the pills even if you start feeling better in a few days. In this example, explaining why they need to take all the pills, even if feeling better, addresses a common reason for medication non-adherence. Part of informed consent involves discussing risks and benefits, which supports informed consent. For example, the benefit of this surgery is that it could significantly reduce your pain and improve mobility. However, like all surgeries, it carries risks such as infection and bleeding. This balanced presentation of both benefits and risks allows the patient to make an informed decision about their care. Always finish explanations by checking for understanding, which ensures effective communication. For example, "I want to make sure I've explained this clearly. Could you please tell me in your own words what we discussed about your treatment plan?" This teach-back technique confirms whether the patient has truly understood or simply nodded along without comprehension. Let's explore techniques for compassionate communication. A key aspect of empathetic care is acknowledging emotions, which validates patient experiences. For example, I can see this diagnosis is upsetting for you. It's completely normal to feel overwhelmed right now. In this response, saying it's completely normal normalizes the patient's emotional reaction, reducing potential shame or embarrassment about showing emotions. When patients are distressed, try using supportive statements, which demonstrates care. For example, we're going to work through this together. Our team is here to support you every step of the way. Here, the phrases work through this together and every step of the way communicate ongoing partnership rather than abandonment in dealing with health challenges. Throughout your interactions, remember the value of practicing active listening, which shows engagement and respect. For example, if I understand correctly, you're concerned about how this medication might affect your ability to drive. Let me address that specifically. This technique of paraphrasing, if I understand correctly, shows you're genuinely listening and trying to understand the patient's specific concerns. In uncertain situations, focus on offering reassurance appropriately, which provides comfort without false promises. For example, while I can't promise specific outcomes, I can assure you that we'll use all our expertise to provide the best possible care. This balanced statement acknowledges limitations, can't promise, while still offering genuine commitment to quality care. In diverse healthcare settings, make a point of respecting cultural differences, which acknowledges diversity in healthcare experiences. For example, I understand your family wants to be involved in all decisions. Let's discuss how we can include them while respecting your privacy. This response recognizes cultural values around family involvement while balancing individual privacy rights. Perhaps most importantly, practice being present, which demonstrates full attention and care. For example, sitting at eye level, maintaining appropriate eye contact, and avoiding interruptions by saying, "I have time to discuss all your questions now." These verbal and nonverbal behaviors communicate that the patient has your complete attention, not just a quick moment between other tasks. Let's review approaches for challenging healthcare discussions. One of the most challenging aspects of healthcare is delivering serious news, which requires sensitivity and clarity. For example, I have some serious information to share with you today. The test results show that you have cancer in your colon. I'm sorry to have to tell you this. This approach uses a warning shot, serious information, to prepare the patient, then delivers the news directly but compassionately with an expression of empathy. Patients often ask about their future, so be prepared for addressing concerns about prognosis, which balances honesty and hope. For example, based on what we know, this condition is chronic, which means it won't completely go away. However, with proper management, many people maintain a good quality of life. This balanced statement acknowledges the permanence of the condition while emphasizing the possibility of quality living with proper care. In some cases, you'll need to handle discussing end-of-life care, which requires compassion and respect. For example, I'd like to talk about your wishes for care if your condition worsens. Understanding your preferences helps us honor what's important to you. This phrasing frames advanced care planning as honoring the patient's values rather than giving up hope. When problems arise, focus on managing dissatisfaction, which addresses patient concerns constructively. For example, I understand you're frustrated about the wait time today. Your concerns are valid, and I'd like to explain what happened and how we're addressing it. This approach acknowledges feelings, frustrated, validates them, concerns are valid, and offers both explanation and solution. As a healthcare professional, you'll sometimes need to practice setting boundaries, which maintains professional relationships while ensuring quality care. For example, I understand you'd prefer a different medication, but this one is recommended based on your specific condition. Let me explain why this is the safest option for you right now. This response acknowledges the patient's preference while firmly maintaining clinical judgment with an explanation. In stressful situations, you might need strategies for de-escalating tense situations, which restores productive communication. For example, I can see you're upset, and that's understandable. Let's take a moment to reset. I want to make sure we address your concerns effectively. This technique acknowledges emotions, validates them as reasonable, creates space, a moment to reset, and reaffirms commitment to addressing concerns. Healthcare requires effective communication between different professionals. Let's explore language for team-based care coordination and documentation. Let's review structured approaches for transferring care responsibility. A structured communication method you should master is using the SBAR technique, which organizes critical information. For example, situation: Mr. Johnson is a 67-year-old post-op patient experiencing increased pain. Background: he had a total knee replacement yesterday. Assessment: his pain is 8/10 despite scheduled pain medication. Recommendation: I think we should reassess his pain management plan. This standardized format ensures complete, organized information transfer with clear identification of the issue, increased pain, and a specific action recommendation. When transferring care, focus on summarizing current status, which provides a snapshot of the patient's condition. For example, the patient is currently stable, afebrile, with all vital signs within normal limits. Oxygen saturation is 97% on room air. This succinct status summary provides a baseline for comparison if the patient's condition changes later, highlighting what's normal now. To ensure proper care continuation, make a point of highlighting key concerns, which draws attention to priorities. For example, the main concern is her fluctuating blood sugar levels. She's had readings as low as 65 and as high as 250 in the past 24 hours. This prioritization helps the receiving provider focus on the most critical aspects of care, in this case, the dangerous blood sugar swings requiring close monitoring. For continuity of care, be thorough when communicating care plans, which ensures continuity. For example, the plan is to continue IV antibiotics for 3 more days, then reassess for transition to oral medication if fever resolves and white count normalizes. This clear plan includes both the current treatment, IV antibiotics, its duration, 3 more days, and the conditions for changing the plan, fever resolution and normal white count. To prevent oversight, be diligent about identifying pending tasks, which prevents oversight. For example, we're still waiting on the cardiology consult which was requested this morning. Also, her MRI is scheduled for tomorrow at 2 p.m. This information ensures important diagnostic tests and consultations aren't missed during the transition between care providers. For seamless handovers, be explicit when clarifying responsibility, which prevents gaps in care. For example, Dr. Martinez will be following up on the test results, and I've already informed the patient's family about the transfer to the rehabilitation unit. This clear assignment of responsibilities ensures accountability for follow-up actions and prevents the assumption that someone else will handle it. Let's explore language for effective healthcare teamwork. During team meetings, practice contributing in multidisciplinary meetings, which adds valuable perspectives. For example, from the physical therapy perspective, the patient has made significant progress with mobility but still requires assistance for bathroom transfers. In this example, from the physical therapy perspective, clearly identifies your professional viewpoint while still requires assistance for bathroom transfers. Provide specific information about remaining care needs that other team members need to know. When you need specialized input, be clear when requesting consultations, which facilitates specialized input. For example, I'd like to request a speech therapy consultation to assess the patient's swallowing function before advancing their diet. Here, to assess the patient's swallowing function explains the specific reason for the consultation and, before advancing their diet, establishes the urgency and connection to current care decisions. When professional opinions differ, Focus on discussing treatment disagreements, which focuses on patient-centered solutions. For example, I have a different perspective on the discharge timing. Given the patient's limited support at home, I'm concerned about their safety. Could we discuss alternatives? This approach acknowledges the disagreement, different perspective, while providing the clinical reasoning, limited support at home, and inviting collaborative problem solving. Discuss alternatives. In urgent situations, be decisive about escalating concerns, which ensures timely intervention. For example, I need to escalate a concern about Mrs. Quood Garcia in room 415. Her respiratory status has deteriorated in the last hour, and I believe she needs immediate medical evaluation. In this context, escalate a concern, communicates urgency while deteriorated in the last hour, provides the timeline that indicates why immediate action is needed. To build team morale, make a habit of acknowledging team contributions, which builds a positive culture. For example, the successful outcome for this complex case was truly a team effort. The coordination between nursing, respiratory therapy, and medical staff was exceptional. Here, truly a team effort recognizes shared responsibility for success, while specifically mentioning different disciplines shows appreciation for each team member's unique contribution. For professional growth, practice offering and requesting feedback, which improves team performance. For example, could you give me feedback on how I managed that emergency situation? I'd appreciate your perspective on what went well and what I could improve. This request demonstrates professional humility by asking for feedback and shows commitment to growth by asking about both strengths and areas for development. Let's review approaches for clear and concise medical documentation. For accurate medical records, focus on writing objective observations, which increases accuracy. For example, patient presents with 4 cm x 5 cm erythematous area on right lower leg with localized warmth and moderate edema, rather than patient has a bad rash on leg. Here, 4 cm x 5 cm exfidium erythematous area gives precise size and appearance, while localized warmth and moderate edema describe specific clinical findings, making the record clear and actionable. To capture the patient's experience, be careful when documenting patient statements, which preserves the patient's voice. For example, patient states, "The pain feels like a knife stabbing through my right side and gets worse when I take a deep breath." In this example, quoting the patient directly, patient states, ensures their experience is recorded accurately and can be referenced by the care team. For treatment evaluation, be thorough when recording interventions and responses, which tracks treatment effectiveness. For example, administered 4 mg morphine IV at 14,030. Patient reported pain decreased from 910 to 3D10 within 20 minutes. No adverse effects observed. Here, documenting the intervention, time, patient response, and side effects provides a complete picture for ongoing care and legal documentation. To ensure proper follow-up, be specific when noting follow-up plans, which ensures continuity of care. For example, plan, continue current antibiotic regimen for 5 more days. Follow up with cardiology within 2 weeks of discharge. Home health to assess wound 3 times weekly. This example lists clear next steps, responsible parties, and timeframes, so nothing is missed in the care plan. For efficient communication, practice using appropriate medical abbreviations, which enhances efficiency while maintaining clarity. For example, PT ambulatory with FWB on RLE requires MinAssist X1 for transfers. Patient ambulatory with full weight bearing on right lower extremity requires minimal assistance from one person for transfers. Here, abbreviations like FWB and RLE save time and space, but the meaning should be clear to all healthcare professionals. To maintain professionalism, be mindful about avoiding subjective judgments, which maintains professionalism. For example, write, "Patient declined medication," stating, "I don't need it right now," instead of, "Patient was non-compliant with medication regimen." In this example, the first phrasing reports the patient's words and actions objectively, while the second is a judgment that could bias. Healthcare providers encounter diverse patient populations with varying cultural beliefs and practices. Let's explore language for culturally sensitive care. Let's review approaches for respectful cross-cultural healthcare interactions. In diverse healthcare settings, practice acknowledging cultural differences, which demonstrates respect. For example, I understand that in your culture, family members often participate in healthcare decisions. How would you like your family involved in our discussions? Here, how would you like your family involved invites the patient to share their preferences, showing respect for their cultural norms. For better cross-cultural communication, focus on adapting communication styles, which enhances understanding. For example, I notice you seem uncomfortable with direct eye contact. I want to respect your communication preferences while we talk about your health concerns. In this example, the provider acknowledges a nonverbal cue and adapts their approach, making the patient feel more comfortable. To provide culturally appropriate care, try asking about health beliefs, which reveals important perspectives. For example, some people have specific beliefs about what might have caused this condition or how it should be treated. Do you have any thoughts about this that would be helpful for me to know? Here, the provider opens the conversation to the patient's beliefs, which can affect treatment acceptance and outcomes. When working with non-English speakers, be proactive about addressing language barriers, which ensures accurate communication. For example, I want to make sure we understand each other clearly. Would you prefer to use a professional interpreter for our conversation? This question offers support and ensures the patient can communicate fully, reducing risk of misunderstanding. For holistic care, make a point of respecting religious practices, which accommodate spiritual needs. For example, please let us know if you need time or space for prayer during your hospital stay and if there are any religious restrictions that might affect your care. Here, the provider invites the patient to share religious needs, helping to create a supportive environment. To balance different approaches to healing, practice negotiating between traditional and modern approaches, which finds acceptable compromises. For example, I understand you're using traditional remedies alongside our prescribed treatment. It's important for us to know about all treatments you're receiving so we can ensure they work well together. This response validates the patient's practices while emphasizing safety and coordination. Let's explore effective practices for interpreted healthcare conversations. When working with interpreters, start by introducing the interpreter role, which establishes expectations. For example, this is Maria. She's a professional medical interpreter who will help us communicate during our conversation. She'll interpret everything we both say accurately. Here, the provider clarifies the interpreter's role, setting expectations for all parties and building trust. To maintain rapport with patients, focus on speaking directly to the patient, which maintains connection. For example, say, "How are you feeling today?" while looking at the patient, not "Ask him how he's feeling today" while looking at the interpreter. This approach keeps the provider-patient relationship primary even when using an interpreter. For accurate interpretation, practice using short, clear sentences, which facilitates accurate interpretation. For example, you need to take this medication twice a day, rather than this prescription needs to be taken on a twice-daily basis for optimal therapeutic effect. Here, the provider uses simple language, making it easier for the interpreter to translate and for the patient to understand. During interpreted conversations, remember the importance of allowing time for interpretation, which ensures complete communication. For example, pause after expressing each complete thought rather than speaking continuously for several minutes. This practice gives the interpreter time to translate accurately and ensures nothing is missed. To ensure understanding in any language, make a habit of checking for understanding, which confirms effective communication. For example, to make sure we're all clear, could you please explain back to me how you'll take this medication? Here, the provider uses the teach-back method to confirm the patient understands instructions, reducing risk of errors. For culturally appropriate care, consider addressing cultural nuances, which acknowledges the interpreter's expertise. For example, is there anything about the way I've explained this that might not translate well culturally that I should be aware of? This question invites the interpreter to share cultural insights, improving communication and care. Let's review approaches for serving diverse patient populations. For holistic patient care, focus on addressing social determinants of health, which recognizes broader health factors. For example, do you have reliable transportation to get to your follow-up appointments? If not, we have resources that might help. Here, the provider identifies barriers outside the clinic that could affect health and offers solutions to support the patient. To increase patient compliance, work on adapting health education, which increases relevance and accessibility. For example, let's discuss how these dietary recommendations might work with the foods typically eaten in your household. In this example, the provider tailors advice to the patient's culture and lifestyle, making it more likely the patient will follow recommendations. As a healthcare advocate, practice recognizing health disparities, which promotes equitable care. For example, we know that this condition often presents differently and may be underdiagnosed in women. Let's make sure we're doing a thorough assessment. Here, the provider acknowledges differences in disease presentation and commits to thorough, unbiased care. When working with patients from various backgrounds, try respecting traditional healing practices, which acknowledges diverse approaches. For example, many patients find that combining traditional healing practices with conventional medicine works well. What approaches have been important in your community? This question values the patient's background and encourages open discussion about all treatments being used. To extend your impact, consider building community partnerships, which extends healthcare reach. For example, our hospital works closely with community organizations that serve immigrant populations. Would you like information about these resources? Here, the provider connects the patient to additional support, showing care beyond the clinic walls. For inclusive healthcare, make a point of advocating for accessible services, which addresses systemic barriers. For example, I'll note in your record that you need printed materials in large font, and will make sure all departments are aware of this accessibility need. This response ensures the patient's needs are met throughout the healthcare system, not just in one encounter. Congratulations on completing our English for Healthcare Workers lesson. You've expanded your medical vocabulary and explored strategies for effective communication in healthcare settings. Remember that healthcare communication is both a science and an art. It requires technical precision, empathy, cultural awareness, and adaptability. Continue building on these skills by practicing medical terminology, role-playing patient scenarios, and reflecting on your interactions. As you apply these communication strategies in your healthcare work, you'll build stronger therapeutic relationships with patients and collaborate more effectively with colleagues. Clear communication is fundamental to providing safe, high-quality, patient-centered care. Keep learning and growing as a healthcare communicator. Your ability to communicate effectively in English will significantly enhance the care you provide to patients and contribute to better health outcomes. Best wishes for your continued success in your healthcare career.